It's time for Health Futures with Cypress Home Care Solutions, Bob Roth. This is Arizona's only show dedicated to providing you with expert advice on how to live a longer, healthier, and happier life. To learn more, call 602-264-8009. That's 602-264-8009. Now, here's your host, Bob Roth.
Good afternoon. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and it must be Friday, and indeed it is. We're coming at you live from the Scottsdale Air Park Money Radio Studios. It is Friday, January 27th, and we are leaning into what is Heart Healthy Month. And if this is the first time you're tuning into our show is about how our older adult population can live a healthier, happier life. How do they do that? They do that by listening to our show. Not so much to me, but to these extraordinary guests that I get on the show. So I have a guest that is coming back for a second time. I have got in the studio with me, I've got Lindsey Thompson. She is with Honor Health. She is the Network Director of Cardiovascular Programs, and she was last here back a year ago, believe it or not. Yeah.
Been 1 year.
Yeah,
exactly.
So you were here January 28th, and this is January 27th, but you were here in the studio with your mom, Kim.
I was.
And you guys were promoting Red Heart Health Month for women. I think we were really focusing in on.
We were, still do, so.
Fantastic. Well, I know you probably have another campaign this year going on, but I'm here to actually talk to this guest here that is right to your right, to my left, and that is Dr. Venkatesh?
Yes, Venkatesh Ramaiah.
Ramaiah. And if it's okay with you, I'd like to call you Vinky.
Oh, that's fine. That's what people generally do.
That's what I heard Lindsey call you, so I'd like to call you Vinky, and that makes it really easy. He is the Chief of Complex Vascular Services and Network Director of Vascular Services at Honor Health. I take it you're a vascular surgeon extraordinaire.
Just a simple vascular surgeon.
There you go, vascular surgeon. So, you know, I it being Heart Healthy Month and really talking about heart disease, as much as we have found and discovered breakthroughs for medicine relating to hearts, it's still the number one killer out there.
Yes, it is.
And you get to see a lot of stuff that is going on, and certainly, you know, I would love to be able to really understand what your role is over at Honor Health, and if you could share with us, me, and our listeners, that would be fantastic.
Thanks, Bob. Thanks for having me. Yes, this is my first time here at your show, and you've got an amazing setup over here.
Well, thank you.
Thank you for having me.
Oh, you're welcome.
So my role as the Chief of Vascular at Honor Health Network encompasses a lot of different cardiovascular disease processes that we treat. Just to step back a little, I was the Chief of Vascular and the Medical Director at Arizona Heart Institute with Dr. Dietrich.
Oh, yeah.
And spent 20 years there and basically honed my skills under his tutelage. So as a vascular surgeon, I deal with a lot of complex cardiovascular and vascular procedures or disease processes. I can highlight a few of them, and then we'll go ahead to see how all of this can help the entire Phoenix and Scottsdale to build what we are trying to do as Cardiovascular Center of Excellence in the Honor Health Network. So my primary interest in vascular are aneurysms. An aneurysm is basically a bulging of the vessels, and it can rupture. So abdominal aortic aneurysms in the belly, thoracic aneurysms in the chest, those are very complex and very dangerous procedures, or disease processes. The second field I like to focus on is strokes. If you see, there is a person every 4 seconds who has a stroke in the country.
Wow.
And although hypertension is the leading cause of stroke, a lot of these strokes are ischemic and are caused by blockages to blood vessels, almost 80% of them. And that's where the carotid arteries, those arteries in your neck that lead up into the brain, are one of the most common causes for strokes. And we deal with multiple different procedures to prevent strokes, like cleaning out the carotid arteries, putting stents in the carotid arteries. And the third and final field of expertise or our dedications that we've done over the last 20 years is saving limbs. As you know, cardiovascular disease encompasses a lot of other disease processes. Diabetes is one, congestive heart failure, atherosclerosis, smoking, lifestyle changes. All of these contribute to cardiac and cardiovascular disease. And for me, amputation is not really the way to treat peripheral arterial disease. I think limb salvage or saving legs and in turn saving lives is probably the best way to treat these patients with diabetes, with peripheral arterial disease. And so we do very complex bypasses, complex devices to open blockages and reperfuse the legs so that these patients can live a very good quality of life as they grow older too. So those three in short are probably my main areas of interest, and that's what I bring to the Honor Health Network. In addition to teaching, education, training, writing some journals, writing book chapters, doing a lot of research activities. And all of this, together with my colleagues at the Honor Health Network, which includes Dr. Bob Riley, who is the Chief of Cardiac Surgery, Dr. Doshi, who is the Chief of Electrophysiology, and of course, Dr. Ryzik, who is the Chief of Cardiology. So what Honor Health Network, and what attracted me to come to Honor Health Network was this compilation of these experts. The city of Phoenix really doesn't have a so-called cardiovascular center of excellence. If you look at neurosurgery, like Barrows, Barrows is known worldwide.
Yes, they are.
So if you had a heart problem, or you need a cardiac surgery problem, or you need surgery from a vascular surgeon, where do you go to? And how does one hospital network differentiate and say we are better than the others? And so my goal of coming to Honor Health Network is there is a team of administrators, very physician-friendly, who are interested in building this cardiovascular center of excellence. So the question is, how do you define a cardiovascular center of excellence? What is it? Is it a concept? Is it a building? Is it an edifice, like Cleveland Clinic, say?
Right, right.
So that's where we struggled first. And if you can ask me, say, why are you doing it now? Why not 10 years ago? Because things have to come together to build a cardiovascular center of excellence. Yes, you can build this huge building and call it the Cardiovascular Center of Excellence, but then you need to have the personnel, the expertise, the research, the infrastructure. So what Honor Health has done is established all those first. We have 5 pillars who are experts in their recognized fields, who have been with the Honor Health Network for years now and established and proved themselves. Then we've built the infrastructure because you need a research group, you need machines, current technology, and you need other skilled people to help you out to build this cardiovascular center of excellence. So all that groundwork has been done. And come this year, the structure of the edifice will get into place at the Shea campus. And that, in short, is our goal, to build a cardiovascular center of excellence in the Phoenix metropolitan area.
Well, I got to tell you, Venki, you did a great job of really giving us an overview of where Honor Health is. And personally, I believe you're already there. I mean, Dr. Ryzik is somebody that is world-renowned for a lot of the research and some of the techniques that he has created and developed right here in our backyard. You know, I didn't share with our listeners, but I have over the years, and certainly this topic is very near and dear to me. I lost my father in November to congestive heart failure, and I lost my mother 20 years earlier, basically to the same thing. But technological advances are really part of the key to success, right? Leadership is a big part of key to success. My mom, back in 1989, 1988, she got one of the very first AICDs. That's
great.
That's the, what do they call it? The automatic implantable cardio defibrillator. That thing was about the size of a deck of playing cards that sat in her abdomen with wires that led up to her heart. And I know today the technology is far greater than that. You're talking about just dropping in what would look like a pacemaker.
Exactly, like a bullet.
With
wireless, leadless pacers and things like that. Yes.
No, so I mean, the technological advances are really a key to success, but the personnel is it. and having leadership like what you have, and you coming to the team and building out that team and the infrastructure that you just described really helped to create that center of excellence that you're talking about. There's so much more I want to talk to you guys about. You can hear the music.
Yes,
I think we got the Who taking us out, right, James? Nicely done. All right, so we're down one segment. We got 3 more to go. Stick around. I've got Honor Health here in the studio. We're talking about cardiovascular programs, centers of excellence. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, taking stock in you. If you're just tuning in, we're in our second segment here. I have got in the studio with me, I got Dr. Ramaiah. He's the Chief of Complex Vascular Services and Network Director of Vascular Services at Honor Health. And I've got Lindsey Thompson, who's the Network Director of Cardiovascular Programs at Honor Health. So we are talking heart health. We are leaning into Heart Health Month, which is February. And if you missed our first segment, Dr. Ramaiah really did a great job of framing the center of excellence that he and his teammates and Honor Health have put together right here in Scottsdale and Phoenix, serving our community. And as Dr. Ramaiah said, there hasn't been a collaboration like this ever in our state. And really, we are lucky to have such a great collaboration here. So, Venki, you did a great job of framing this and really talking about what you have created here, you and the team have created. And certainly, I would love, Lindsey, if you could take us through what a patient or consumer, if you would, for lack of a better, what does that look like when they go through this journey for the Center of Excellence?
So, our goal really from the start, this has been a labor of love since, I came to Service Line in 2019.
2019, yes.
And we were really ramping up the discussions then. So we've been talking about this now for a long time and really looking to make things move and shake. And I think COVID really kind of put a damper in all of that, but we're forging ahead now because I think now is the perfect time to do this. So our goal really has always been, we kind of came up with a saying a few years ago around making heart healthy or your cardiovascular care personal for Honor Health. And I think in designing this, that has really been at the forefront of our mind. So we see things every day. There's many of us that have been in the system for a long time. I've been there for I'm going to my 21st year working there. So
wow, 21 years?
Yes.
You don't look like
everyone
you're
says I was
more
born
than
in the
25.
hallway. I just
Exactly.
keep saying yes, exactly right. So I think that as we kind of have grown and really seen things take shape in the market and how Phoenix market has changed so much, we see that there is a really large-scale need to continue making that journey for the patient very personalized, offering things where it's an easy access for the patient. So we're going to have an OBL ASC, so that's an office-based lab or ambulatory surgery center. A lot of things for cardiovascular care is moving towards that ambulatory setting now. It's cost-saving for patients, payers, and all of those things are aligned. So we recognize that. We want to make sure that we have a good, safe place. So it's going to be on the campus of the hospital so that we have all of everything right there for our patients. So we'll have a 2 or 3 room ambulatory surgery space to do outpatient procedures. We're also building, what we're really proud of, is a dedicated cardiovascular intensive care unit. So this will be a first for the Shea Medical Center to have a separate designated space for all of our cardiovascular patients that will encompass specialty trained physicians, intensivists that specialize just in critical care cardiovascular services, anesthesia geared just towards our cardiovascular patients, all those things that really provide that personalized special touch around creating a center of excellence for cardiovascular care. So it's going to have the ICU, really geared towards wellness. On the first floor is going to be, I think Dr. Shaw got his way, and we have a juice bar going in. So
All right.
we're going to be really focusing on that wellness component. So juice bar, there's the ambulatory stuff. There's things that make it so that it's easy for you to get all of your care in one place. Having your physician's offices all within that walking area of the campus, so that you're not having to go run around 7 different places to get your tests done. See, many of our cardiovascular patients, not only do they have a cardiologist, but then they also see Dr. Ramaiah for their vascular care needs, and then they see Dr. Doshi for their electrophysiology needs. So cardiovascular patients are complex patients, and we recognize that. We want to provide a space for them to seek all of their care in a one-stop shop. And so I think that what people will see is it's going to be high tech, highly innovative, and it's going to provide them that space that they need with all of our niche programs. We have things geared specifically towards women. As we talked about last year, that's a really big passion of mine.
Oh, yeah.
And as well as Honor Health has really jumped on board with that. So we are continuing that component in this building, and I think it's something that we're all really proud of. We want to, we've been here a long time. I've grown up here in the Phoenix area almost my entire life, and it's something that we want to leave it in a place better than we found it, and we want to make sure that we are providing something for the community, and not just a place to just bang out the procedures and go home for the day. Because I think that, like Dr. Ramaiah said, we have a team that's very dedicated to this, and this is really kind of a passion project for most of the people involved, I would say.
So all of this has been in the plan since 2019. You hit a speed bump with COVID.
Yeah.
All these pieces and parts are being put together. Is it been assembled so far, or are you looking for a grand opening, or is it already opened?
It is not open yet. We're looking to start breaking ground here fairly quickly. It's going to be a phased project, so the surgery center area should be open probably, I think we're shooting for this time next year. And then the rest of it is kind of in tandem. So the CVICU and those things will start to take shape as well.
How exciting.
Yeah.
No,
yeah,
it really is. And I think the key word for me is you use the word ambulatory, right?
Mm-hmm.
I talked about my parents, and my dad, about 3 or 4 years ago had a TAVR done. That's a transcatheter aortic valve replacement. And they did that through his carotid because they couldn't do it through his femoral artery. And the fact that they did it like they did so quickly and then got him up and moving, I am telling you, that man couldn't walk 50 yards without stopping because he was out of breath. And literally within hours, he was walking, and he could have walked 500 yards without stopping. That's how quickly he healed. And I'm just talking about a TAVR, but in those days, the old days, they used to crack the chest, open it up, and you were in the hospital for weeks. And now the stay, and that's why I use the word ambulatory, the stay is very limited. You want them out, right? You want them getting back home and getting back being productive citizens in their community and their families.
Yeah, I think that's something, I came to cardiology clinically about 12 years ago. And that was really when things started to ramp up, I think, in terms of technological advances for us. So I think in seeing where we've gone in that 12 years, it's pretty incredible. My grandma also had one of the very first TAVRs that Honor Health did. And seeing what she went through versus what our patients go through now, it's actually very incredible. We have patients going home in the very same day. Similar concept what Dr. Ramaiah does for EVAR
we
and
used
all those things.
we used to operate on aneurysms, split your belly open from stem to stern.
Wow.
Take the intestines to one side, get to the aorta. So those patients would stay in the hospital, like you said, a week or two. Now, with the recent advances, we are doing stent grafts, which basically mean go through your groins like you had your dad had your TAVR, and patients go home the next day.
That's
So the
fascinating.
technological advances in cardiovascular surgery and medicine have been tremendous. And that's why there's this tectonic shift of moving these cardiovascular procedures to the outpatient for the benefit of the patient, for the smoothness, and for accommodating a lot more patients than putting them in the hospital.
It's remarkable. It really is. And hats off to Honor Health to really pull together the team, the infrastructure, and really the services that you guys are looking to provide. You know, you talked about aneurysms, you talked about strokes, and you talked about saving limbs. I mean, those are the three components that you really focus in on.
Very true.
And limb loss was a big deal back yesterday. And today that you're able to save people's limbs, able to save, toes and fingers, is a big breakthrough.
It's one of the first times that the amputation rate has actually gone down across the United States.
Wow,
With this focus on education, easy and recent advances, and patient care,
With that, we got to take a break. It's halftime here at Health Futures.
Great.
Stick around. We're talking to Honor Health about their cardiovascular programs. We'll be right back.
Now back to Health Futures, taking stock in you. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures. We're in the second half here of our program. And if you're just tuning in, I've got Honor Health here in the studio. Specifically, I've got Lindsey Thompson. She's the Network Director of Cardiovascular Programs for Honor Health. And then I've got Dr. Ramaiah, who is the Chief of Complex Vascular Services and Network Director of Vascular Services at Honor Health. If you missed the first half, go out to our website at cypresshomecare.com. Click on the media button. Radio show button is right below that. You can catch this show and many, many more. So, Dr. Vinky and Lindsey, you guys have done a great job of really talking about this center of excellence that you have created, and that is really in the works, and it sounds like the beginnings of it will start to open up in first quarter of 24. I really want to get into more of the why. Why are we going this route? I think I know, and certainly the fact that we are here just ready to approach Heart Healthy Month is really important to talk about this, and it's important to talk about hearts because it's still the number one killer of Americans and people worldwide.
Yeah, I think, the why of this, like we talked about a little bit, we touched on it a little bit before, but the why is, I think we said the time is now. We had just had a foundation campaign around raising money for our Center of Excellence, and it's called The Time Is Now. So I think right now is perfect timing for us in that we really have the stars aligned for us. The universe has perfectly clicked in place for us, that we have all of our elite medical expertise in place. We've got our team of highly skilled cardiovascular specialists, as well as like the knowledgeable and compassionate nurses, pharmacists, technologists, echo techs, exercise physiologists, OR. We really have such a great team of dedicated people at Honor Health, and I think the other piece is people have been there a long time, and they're dedicated to growing this program into what we all know it has potential to continue to be in our community. So I think the other piece is, as Dr. Ramaiah talked about in the first segment, Phoenix really has no kind of academic standard of care like bearing on, driving clinical expertise in the community. It's a very strange market here sometimes, I think, and it truly does feel like Wild Wild Westish sometimes. Mm-hmm. But I think we have done an excellent job over the years of sticking to what is important to us. We're a community-based hospital. We are a not-for-profit. We're here to serve our community, and we have done an excellent job of sticking to that foundation as we have grown to 6 facilities in the community. But our focus is on providing care for the community, and we feel like we have the ability to be that standard bearer of care in our community with our physicians like Dr. Ramaiah. We have world-renowned, as he touched on before. We've got the innovation component of heavily involved in research. We have a huge research center where we have, I think the last time I looked at the email, I think we had
40 to 50
yeah,
studies?
50 studies going on, active studies right now, and they range from device-based therapies to we've got blood pressure, we've got genetics, we've got all kinds of different things going on in cardiovascular care. We've got things geared. We're working on some stuff around engaging some women in clinical trials because we are grossly underrepresented in clinical trials, especially for cardiovascular. And it's so important as you kind of move through things. So the other piece is, like I said, making heart healthy personal. We have a comprehensive team that covers care navigation services for cardiovascular care. We've worked to build an excellent team that covers, we have structural heart navigators, we have vascular care navigators, we have AFib navigators for people that have atrial fibrillation. We've got it all at this point, and we're really proud of that, and we want everyone to know that whatever your cardiovascular need, we really do have someone that is there to help you and get you back on track again.
You guys are doing some amazing things, and you talked about the 6 facilities that you've got throughout the valley, and certainly, we all, for those that live here in Arizona, especially in Scottsdale and Phoenix, we all know that the Osborne campus is a Trauma 1 campus,
yes.
number 1, and number 2, it's a stroke center of excellence, and that's where you go if you are dealing with strokes and other issues related to that. But the Shea campus is going to be the heart center of excellence. That's where you guys will have the center of excellence, just like you have the Virginia Piper Cancer Center there, which is really, really exciting. I mean, Lindsey, I'm looking at you, and you've been with Honor Health how many years now, 21?
This is going into my 21st year.
Okay, so I've been coming here to the Valley for close to 40 years, and I remember Scottsdale Memorial. And I remember the front being the back and the back being the front and then the front being the back again, and just watched it grow from Scottsdale Memorial to Scottsdale Healthcare to Honor Health. For me as a community resident, it's been something really to be seen. And the other thing I'll say about Honor Health, and I'm not saying it just for you guys, but I mean, even though you're a much bigger organization today, you still are a community hospital.
Right.
You're my community hospital.
I think that's something we should not lose focus on.
Right.
We don't want to become so academic that we lose touch to the people we treat. And so we are still a community hospital, but we have aspects of delivering the highest quality of care. And I think the why is because there is an unmet need. Why this new technology? Because this technology meets an unmet need. Why this center of excellence? Because we really don't have this so-called dedicated center in Phoenix. Phoenix is now, the 5th largest city probably?
I believe so.
Yeah. And so I still remember when I first came to Phoenix, summer, we would do 1 case and we were done.
Wow.
The rest of the day in summers were just, ORs were empty. There were no real people around. The visitors were left, everything, exactly. Yeah. But now we are busy year-round. Summers are busy, winters are busy, and so we have to accommodate for that too. And so the why is because there is a need for this to happen. And the reason why we're doing it now rather than earlier is because we also have the people in place, the personnel in place, the technology in place, the assisted help that you need from the OR staff, from the nurses, from everyone, including the janitors, because the whole focus is the team. It's very easy to say it's 1 person, 2 people, but what Honor Health has done now is built the team first.
Dr. Ramaiah, I love how you said that, the team first.
Yeah.
And when we leaned into this part of the conversation, we talked about the community. Mm-hmm. And Lindsey, one of the things you said is that the foundation was able to help get this thing started. And my family, my mother and father are part of the Circle of Distinction program, and philanthropy is part of the community. And certainly hearing you say that says the community got behind this and supported this and got it up off the ground.
I think that that is something that not a lot of people know. Truly, we really couldn't do many of the things that we do within Honor Health without the support of our foundation and our wonderful donors that help us out every single day. This project is primarily going to be, supported by our donors, and that's super important to us that we continue to build those relationships and, work with them in our community because, like I said, without them, we really couldn't do any of this. But it allows us to stay grounded too. We really, there's a lot of things going on, but we have donors who are extremely grateful who come to us for their care, but that they want to continue to support us so that we can continue providing that care that they received to others in our community as well.
I love that. I really do. And that really helps establish the Center of Excellence. So we're down 3 segments. We got one more to go. There was a stat that was given in one of my shows years ago from a cardiologist saying that when a person has a heart attack, within the first year, they go back to the same lifestyle that got them into that situation. 70%. And 90% by the second year. So I want to talk about behavioral modification, and I want to talk about lasting thoughts for our listeners. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth. Stick around. We got one more segment. We'll be right back.
Now back to Health Futures, Taking Stock in You. If you have questions about your own or your loved one's future health care, call 602-264-8009. Now, here's your host, Cypress Home Care Solutions, Bob Roth.
Welcome back. You're listening to Health Futures, Taking Stock in You. I'm your host, Bob Roth, and we're in our 4th segment if you're just tuning in. I've got Honor Health here in the studio. I got Lindsey Thompson. She's the Network Director of Cardiovascular Programs. And I've got Dr. Ramaiah, who is the Chief of Complex Vascular Services and the Network Director of Vascular Services at Honor Health. If you missed the first 3 segments, go up to our website at cypresshomecare.com, click on the media button, radio show buttons right below. You'll catch that first half, or should I say the first 3 segments, and you'll also catch about 500 more that we've been bringing to you for the last 10 years. It's hard to believe I'm in my 10th year here, guys, but, this is so important to talk about heart health. And, I want to really talk about how I led into this segment talking about the fact that 70% of heart attack victims, I'll call them, within the first year go back to the same lifestyle they led before, and almost 90% after 2 years. I love what you guys have created, the Center of Excellence. I love, Lindsey, you talked about navigators. And I look at navigators as coaches, someone to maybe hold people accountable. But, certainly as we end our show, I want to really talk about last thoughts and talk about knowing your numbers and how important that is.
Yeah, I think, so I was actually just jotting down some of my fun little facts here. I think that knowing your numbers is critical. I think what we have found, right, is that prevention is the number one key to cracking kind of the cardiovascular disease component. So knowing your numbers is critical in that. It's really something that everyone should know. So knowing their total cholesterol, your blood pressure, blood sugar level, and body mass index. Another thing that we found too is your family history. Genetics.
Very important.
Genetics have really, really kind of reared the head at things where we've come a long way just very quickly with respect to cardiovascular genetics. There's testing that they can do to see if you have a genetic marker that makes you unable to digest certain medications properly. So it's really, there's so many different things. You're at risk for certain arrhythmias, other things like that happen that go along with that. And I think just having more of a greater understanding to what and who is at risk. And I think, as we've talked before, Bob, and Dr. Ramaiah knows my stance on this, I think women really need to wake up and kind of have a reckoning to understand what their cardiovascular risks are. I think women in general, women ages 30 to 40 are 2 times more likely to die from a cardiovascular caused disease versus breast cancer. That stat has not changed anytime recently. If anything, I think people are so heavily focused on breast cancer, and I think that we absolutely should be. There's been very clear parameters and screening guidelines, but I think where we've lacked in that is that there's not clear screening guidelines for cardiovascular disease for women, and I think that's something where I think we need to move the marker on that component. The other piece, and speaking into Dr. Ramaiah's world, is 60% of all stroke deaths were women versus men.
Wow. 60%.
Mm-hmm.
Yes. I mean, there is, Bob, you hit a very important point here. So we as surgeons, interventionists, are so focused on developing new technology, new ways of treating the disease process, but we tend to forget to focus on how we can prevent most of this stuff. Now, if you take a patient who's, say, had a limb salvage procedure, say, of his right leg, 1/3 of those patients will require another procedure within 18 months.
Wow.
Just by the disease process. 1/3 of those patients will need a procedure on the other leg within 18 months. If you amputate one leg, there's a strong possibility that 1/3 of those patients will lose the other leg within 18 months. So the data is there, the numbers are there, and it's extremely important to know those numbers so that you can not frighten the patients, but at least show them what's going to happen if they don't continue to follow up. And that responsibility rests not only with the healthcare professionals, but also rests with the patients themselves. And I think the more we focus and more we educate our patients, and the more they take responsibility for their own health, the better society will be in terms of healthcare.
And really, it's getting the message out. It's having a radio show like this and having a center of excellence and being able to communicate this. I mean, I will tell you that, my father and my mother both died of heart disease. Mm-hmm. My father and mother were smokers back in the day. My father and mother led a more sedentary lifestyle. And that is very indicative of the people of the silent and GI generation. But the boomers are looking at things very differently.
Very true.
And certainly moving is a big part of it. Eating a healthy, well-balanced diet. I shared with you who my cardiologist is, and he told me that I need to be on a Mediterranean diet. And I said, okay, I like the red wine part. I like the olive oil part.
Behavioral modification, especially in cardiovascular disease, is key. And that's why, as you build this cardiovascular center of excellence, we have a series of navigators. Someone who picks up the phone, makes sure that the patient is maintaining whatever good work we did in terms of restoring blood flow to his leg or to his heart. Because unfortunately, vascular disease, we don't really cure it. Mm-hmm. Because it comes back. All these blockages in your legs, in your heart, they tend to come back. And so being very, very preventive or very aware is extremely important, because the earlier you catch it, the better the results.
No doubt.
Yeah, I think probably the biggest thing that I would say people should focus on is knowing what their blood pressure is too.
Sure.
I think that people aren't quite aware that the numbers changed not too long ago. When was that? 5 years ago?
About 4 or 5 years.
Yeah, 4 or 5 years ago, we changed the numbers. The guidelines are actually different. So people are like, oh, my blood pressure is 120/80. It's perfect. That's not perfect anymore. That's considered, you're on the verge of having elevated blood pressure. So a normal blood pressure is below 120/80. So that is the biggest thing, because really what the AHA has done in some of their research is they've identified the people with high blood pressure. They stated that if you could eliminate hypertension, you could reduce cardiovascular mortality by 38% among women. Because there are so many more women, you have high blood pressure, and people don't know. It's kind of a silent thing until it's not, when it's out of hand. But there are so many different things that you can do that, you don't have to always take a pill to reduce your blood pressure. If it's borderline, there's a lot of dietary or lifestyle changes that you can do that will greatly impact your blood pressure very quickly, that we've seen. So I think educating people, focusing on prevention, getting your yearly physical, knowing your numbers, making sure you are seeing the doctor when you're supposed to, knowing your family history. If you have parents that both had high blood pressure or are on blood pressure medication right now, there's a good possibility that you're probably going to need some blood pressure management later on in life as well. So I think that those things are really important for people to recognize, even if they're like, well, oh, my parents lived a really hard life, or they had a different lifestyle. There's still a genetic factor in those things, and it's really important to recognize that as we go through life. So.
And the one thing I want to bring up too is, you say all of these things as relates to prevention, especially knowing your numbers. But so many people don't go in for their annual checkup. And it's so important. I mean, I think the numbers are less than 30% go in to get checked out.
Routine yearly checkup.
You need to go and get your numbers. You need to go in for your annual checkup. And you know what? If you have health insurance, they pay for that.
Yeah.
You need to make the appointment. Now, don't get me wrong, COVID changed a lot. And a lot of people did not want to go outside of their home. They did not want to go to the doctor. But you know what? It's safe now. And if you feel like you need to be protected, wear a mask. That's okay. It's more accepting now to wear a mask, but you have to know these numbers. You have to know what you're up against.
It's true. And I think it's extremely key, especially cardiovascular disease, is behavioral modification. I mean, you treat a patient for cardiac disease, or you treat a patient for peripheral arterial disease. There are risk factors. We all know what the risk factors are: smoking, high blood pressure, cholesterol, diabetes, lack of exercise, obesity. All of these are well-known factors. But you got to focus on educating the patients. I think that's extremely important, because even in my practice, we know I've operated multiple times on this patient's leg. And even when he knows that his bypass doesn't have a pulse in it, he can't feel it, he thinks, I think it'll get better. Right. So sometimes it's better to be safe than sorry. So see your doctors, keep up your annual appointments, live a healthy lifestyle. And I think that's the basic message for leading a healthy life and a good cardiovascular existence.
As we wind down the show, and I know we only have a minute or two, I really looking at you, Lindsey, because you and Kim were here talking about women's hearts and heart health, and really want to talk about women. 60% are having strokes. Most people think that heart attacks are a guy thing. I'd like you to leave a lasting thought or two about women and hearts.
I think, me being younger, I think what I would tell my women of the same age as me, I'm going to be 38 this year. And I think that biggest thing is you're not invincible. We women are not invincible. It can happen to you. And chances are there's two women in this room. One of us is probably going to have a cardiovascular event at some point in our life. So the chances are high, and you need to take care of yourself.
And you need to know your numbers.
Yes.
You need to get in to see your PCP.
Yep.
Well, Lindsey Thompson, Dr. Ramaiah,
thank you for having me.
It's been really good to have you. Heart Health Month coming up in February. Know your numbers. Prevention, what is it? An ounce of prevention is a pound of cure. Prevention is the key. Stick around. We'll be back, or should I say we'll be back next Friday. Health Futures, we're out.
Thank you.
There's no place like home. You've been listening to Bob Roth's Health Futures. If you have questions about your own or your loved one's future health care, call Cypress Home Care Solutions at 602-264-8009. That's 602-264-8009. Or visit cypresshomecare.com. Be sure to join Health Futures with Bob Roth every Friday at noon, right here on Money Radio 1510 and 105.3 FM.